was asked if I could explain a little more about how I regained my bladder control. Well, the first thing I did was make sure that they got the indwelling catheter out of my body. That was really critical. The bladder, when it's just draining constantly, forgets its functionality. And a bladder's function is it fills up, gets to a certain point of being filled up, and it stimulates the bladder sphincter to let the brain know that this urine needs to come out. And when you have an indwelling catheter, that whole process, the bladder never gets filled up. And as the longer an indwelling catheter exists, the smaller and smaller and smaller the bladder gets. So I preferred to have the intermittent catheterization. Now in my case, I did not have the handedness to be able to do that for myself, so this was something in the hospital, 6 times a day. And when I got home, initially it was 6 times a day, and there was a home care nurse. She took care of some of that, but mostly it was my husband and my daughter who took over that function. And we were able to move this down to 5 times a day, but the urine output, the volume, was important to register that. I was able to keep my bladder in a normal size because it was being allowed to fill up. And right before I was being cathed, I would imagine what it was like. I would recall what it was like sensation-wise to move urine out of my own body. I would think about it. I would create the sound of what that sounded like, urine going into a toilet, whatever. I would imagine those things, and I would imagine pushing the urine out of my body myself. Now, I did this 5-6 times a day for 6 months before I ever got 1 drop of urine out of my body from that process. But that process allowed that first drop of urine, and so it was like a big giant yes for me. A drop. So I just kept doing that over and over and over and over again. And I got to the point where I could move half of the urine out of my body, and then I would get catheterized. And then I started wearing a diaper at that point because it allowed me to practice more often. I would just imagine it. And if I could get urine out, this was great. Fortunately it got trapped by the diaper. And so this was a great medium for practice. And I just kept working with this. Gradually, I was able to empty my bladder completely. Now, some of that emptying was, I would empty, and then at the very tail end, I would actually place my hand on the area above where the bladder sits in the body, and I would manipulate, or actually push, both from the inside with my mind and my structure, and the outside to stimulate the movement of this urine completely, so my bladder would be completely emptied. This was important because even though urine is a clean liquid coming out of the body, bacteria can be introduced into the body with the catheterization. So you want to make sure that the body gets completely emptied so bacteria can't build up in any urine that's left in the system. What occurred in this process is gradually I didn't have to be cathed anymore, because I would eliminate, I would, do the manipulation on my own bladder, and then I would get cathed, and eventually there wasn't any urine to come out via catheterization. So I had regained. Now, how long did this take? Whoa. That's a good question. And again, I hesitate to say this is how long it took me, because we're all so different. I don't want to set a framework of the amount of time that it might take for you to, if you choose to do this process, to do it. Because in my mind's memory, this was a year process before I was actually completely away from catheterization. Sometimes I understand that doctors will call this natural elimination of urine, they call it leaking, and so they try to stop the leaking. Sometimes they give drugs to dry this up, and this made no sense to me whatsoever. I think that the idea that it's leaking is actually the body's response to really attempting to come online. It wants to come online. So what you do is you handle the idea of leaking by using whatever diapers are out there. I mean, they have diapers for men and they have diapers for women. And with men, they actually have it's like a little prophylactic device that you can actually put over the penis that catches the urine. So it's not an issue of having to wear a diaper. But that's, since my anatomy isn't of that nature, the diapers really came in handy. Like I say, allowing me to practice. And I'm really grateful that they exist. So a lot of adults just have to get over the idea, oh my gosh, I'm an adult, I can't wear a diaper. Well, yeah, actually you can. And be grateful that they exist, because it will allow you to practice. One of the things about urinary output is you need to get enough liquid input to keep the bladder healthy. And conversations exist that you should be drinking, 8 glasses of clear water a day. I do believe that it really makes a difference into how big your body is. I'm a little person. I'm like, well, after surgery, I'm probably 5'2". So I get a minimum of 6 glasses, 8-ounce glasses, so basically that's 6 cups of clear water. I also drink tea. I avoid Coca-Cola and all that stuff like the plague. I don't go there, but I never have. Because the sugars can set the bladder up for infection. I also found that through this time of dealing with bladder that I've had 2 urinary tract infections in 17 years. So that's a fairly significant track record. I have had the beginning of a urinary tract infection, but I have always checked my urine for the smell of it. You can tell a lot from the smell, and you just, folks, you just got to get over it. This is stuff, this is coming out of your body. You want to know what it looks like, what color is it, what it smells like, so you can manage your own body. urinary tract infections are not something that you want to continue to get. It can cause so many other issues in your body. One of the things that I discovered along the way is that there is a natural sugar that's actually produced in the body called D-mannose. And I take this as a prophylactic supplement, if you will. What it does is it makes the inside of the bladder slick. So bacteria cannot easily adhere to the lining of the bladder. And this is something that has been a great asset to me. I've passed this along to other people. There is a product out there that it's just a capsulated form, and it is a combination of cranactin, which is the active ingredient in cranberry juice, and the D-mannose. And I take that, and I think that has been a significant asset that keeps my body healthy and keeps it from getting urinary tract infections. Whenever I have a off smell, you can get an off smell from eating asparagus, right? But when there's an off smell in the urine, I will automatically increase my water intake and my intake of D-mannose. And this has eliminated or stopped the bacteria from building up in my body. That's why I'm sure that my 2 times of having a urinary tract infection, that's part of the process. That's why I've been able to keep urinary tract infections away from my body. Those of you who are having to cath, you do have this possibility every time you cath of introducing new bacteria into your system. So having clean catheters, having clean hands, all that stuff is really important. Will following my routine enable you to regain your ability to move urine out of your body? Maybe. I know that if you don't try anything beyond the standard way of treating the bladder in spinal cord injury, that you have what you have now. So there's no loss in giving this a try, or even eliminate the idea of trying and just do it and see what happens. That's my input.